Hi, my name is Alex Black. I'm a student physical therapist at the University of Missouri-Columbia, and today I'm going to be looking at the effectiveness of physical therapy intervention um, to reduce opioid use, specifically early intervention. Uh, so that brings me to the first slide about just the prevalence of the opioid epidemic and the fact that it is a issue that we need to work on. They're frequently prescribed for pain. We know they can be addictive and have negative side effects. Just putting some numbers to it, in 2014, there were 750,000 people that were undergoing treatment for abuse of prescription opioids. And then the last 15 years, prescription opioid overdose has quadrupled. Um, Overdose leading to death has quadrupled. And then in 2018, 70% of drug overdoses involved in opioid, and opioid misuse accounted for $60.4 billion in added healthcare costs. So it is a very prevalent issue in today's society, and it continues to become more and more prevalent as the years go on. So that brings me to a few studies that looked at how early PT intervention can impact opioid use. So this first one was a review, looked at a lot of the current research on early PT intervention on opioid use, and it found that the studies concluded there were lower odds of opioid prescription for musculoskeletal pain following physical therapy, and there were lower odds of opioid prescriptions, more specifically within 14 days if physical therapy was started versus 90 days. So that just shows that impact of early intervention versus delay in care. And then lower opioid use in a hospital setting, if it was post-operation day 0 versus day 1, the day 0 patients also showed lower opioid use than the day 1 patients. So getting in there really early, getting them up and moving, that intervention really helps lower the use of opioids. And this 2020 study compared receiving opioids first and then physical therapy later, or physical therapy first and opioids maybe later. And they found that the early physical therapy led to improved function, decreased pain, and decreased opioid use, showing that physical therapy can kind of act as the opioid itself almost versus starting out with that opioid and then going into physical therapy. So more specific conditions, a 2018 Harvard study found that early physical therapy in patients with shoulder, neck, knee, or low back pain can lead to a 10% reduction in opioid use. This is huge. Musculoskeletal pain costs the healthcare system an estimated $874 billion annually in the U.S. And this study suggests as many as 1 in 2 adults that they surveyed had musculoskeletal pain. So it shows it's a really prevalent issue. It's common to get prescribed opioids for some of these more chronic conditions, and it's been shown that physical therapy can lead to a 10% reduction in opioid use. A 2015 study found that early physical therapy can lead to lower opioid use as well as lowered costs by 60%. This one specifically looked at low back pain, which is a very common reason for patients to seek care. This study said that of their surveyed, they would guess that as many as 25% of Americans say they have low back pain within the last 3 months. So again, just these really prevalent issues that drive patients to care and often drive patients to opioid use can be impacted by physical therapy. And as far as applying it, what's the role of the PT? Why do we care as physical therapists? Well, for one, opioids impact the health of our patient, so we should care from that perspective. As far as physical therapy specifically, pain is a very frequent reason for a patient to visit physical therapy. It's common that that's their first complaint. It's a big part of our subjective interview, so that should be on our radar from the get-go. We should be advocating for our patients' care, and that includes their use of opioids and educating them. Patient education is huge, and that's definitely within our role. Early intervention and mobilization is key, and it's been shown to prevent opioid use or at least decrease the use of opioids. And just our general scope of care and the practices that we use on patients can help. Like therapeutic exercise has been shown. It's a big part of our treatment to develop these exercise plans and show the patient how to execute them properly. And if they're doing that, it can lead to decreased pain, which in turn decreases their opioid use. Manual therapy techniques, the hands-on movements of joints and muscles, um, can help with inflammation, pain, impaired range of motion. It's been shown to be applicable for a variety of conditions, and it's just another way that we can combat pain from a physical therapy standpoint that decreases opioid use. Patient education, I already mentioned. Just key for us to realize that we need to advocate for our patients' health, and that opioid use is a big part of that, and we need to be in contact with their doctors and make sure they have all the information available to them on the negative side effects as well. And then managing stress and managing sleep. When your patients are undergoing all this therapy, they had recent injuries, they have pain, keeping that stress in check is key, and then making sure they're getting 7 to 9 hours of well-rested, uninterrupted sleep, so that they can recover from the exercises they're doing and actually start to get better. So I think it comes down to just understanding that we do have a role and can decrease opioid use in patients through our physical therapy intervention, and then just understanding that and applying our care in a way that benefits them and making them understand that maybe this can be an alternative to opioid use rather than just in conjunction with it. And here are my references.